Welcome to the Therapy Corner. Glad you could come and visit us again. As you know, this is a time when we talk about counseling and therapy and other things psychological in hopes of dispelling myths and helping you to understand what mental health is all about. Today, we are really happy to have with us Robin Cofield. Robin Cofield is a licensed marriage and family therapist. She is also a National Nurturing Parenting Program trainer. And I had to read that because that's way too hard for me to remember. And she has a private practice down in Orchid. And she also works for Child Abuse Listening and Mediation, better known as CALM. And she also works for Optimal Intervention. So she's a busy little lady. So I'd like to welcome Robin Cofield.
Thank you. Thank you for having me.
And today we're going to be talking about parenting because, as I said, you're a National Nurturing Parenting Program trainer.
Correct.
And it's a passion with me. I see a lot of things going on out there in the world that disturb me about parenting. And so why would someone come to a parenting class? Why would they suddenly decide that they need a parenting class?
Well, sometimes they decide voluntarily that they need a parenting course, and also sometimes it's mandated that they attend a parenting course. And individuals come to gather advice, suggestions, strategies, and how to implement tools to parent their children more effectively. And they also get advice on co-parenting skills as well.
Co-parenting, that sort of ties in with when you said mandated. So when you say mandated, you're talking about courts, right? These are people who've gotten involved in the legal system, and therefore the court is saying to them, you will go to parenting classes.
Yes.
Okay. I'm curious, when people are mandated, how do they take to the parenting classes? Do they get involved, or do they just kind of sit there and go, all right, what are you going to tell me?
Eventually they get involved. However, even with the voluntary cases, there's a little bit of resistance that comes with it. With any type of education or the word class, individuals sometimes view that as, I'm not good enough, I need more, I don't have enough skills, and there's a little bit of resistance in that piece. It's not until they get adjusted to the group or the individual session, they start to come out of that a little bit. As they learn more skills, the confidence increases, they feel more competent in implementing, and then that shifts a little bit.
Okay, that's really encouraging. I'm glad to hear that. So if you were coming voluntarily, what would you say is what keeps people from coming to a class? I mean, you know, I happen to notice I got my catalog from Hancock yesterday, and in it there was a parenting class in the evening given through the community college part. And why would somebody go, and why would they seek it out, do you think?
They may be encountering some challenges with their children throughout the different developmental stages. Things change. We know that there's different pressures out there that children encounter. They may come to their parents and voice a concern, and the parents may not know how to handle that appropriately. Times have changed. There's new pressures, and it's not always the easiest task to know how to approach that and manage it. So they might come to the parenting course and ask for that, and maybe brainstorm ideas with other parents if it's a group setting.
So I'm guessing what I'm hearing is that it's sort of like they look at their parenting and say, gee, what mom and dad did with me isn't working with my kid or kids. That sort of thing. And so they're struggling with the way the child is acting now, which may have been very different from the way kids acted maybe 20 years ago.
Or what was deemed appropriate.
So societal values come in.
Right.
Oh, interesting.
And that's a different way of parenting. Individuals may have a tough time getting on their child's level, talking it out. The role of the parent has changed because discipline techniques have changed.
Yeah, I actually worked with CALM about, oh God, I hate to admit, 30 years ago. Terrific organization, does a lot of really wonderful work, but I was shocked and appalled, actually, to hear some of the stories of people and what they have done with their children. So, when I confronted my father about his abusive upbringing of me, the one thing that really saved me was he simply lowered his head and said he didn't know any better.
Right.
And so it struck me, oh, duh, where do we learn to parent? From our parents. And our parents may not have been the best parents in the world. So hooking into what you were saying in terms of punishment or discipline, would that be one of the topics that you would cover in your parenting classes?
Absolutely. A nurturing parenting program created by Dr. Stephen Bavelek. He really, really stresses the importance of a no tolerance for corporal punishment. So we do go over realistic expectations, we go over appropriate discipline, we go over parent-child roles and understanding what they are. We do go over learning about empathy and in promoting independence for a child to explore safely in their environment. It's hard to let go a little bit and allow the child to explore, but we want to ensure that the environment is safe and healthy and appropriate. And that's where those boundaries come in, and trying to do the dance a little bit.
Yeah, I'm glad you said that, boundaries, because that was one of the things when I teach my general psych class, and we do cover aspects of parenting in that class. And one of the things that I have tried to stress with my, as I call them, future parents of America, is the need for the boundaries, that yes, the child has a natural need to explore. Any any biological organism is going to explore. Even an amoeba explores its surroundings. So it's natural that they explore, but they need boundaries, because boundaries is very much a part of life. And it seems that parents have a difficulty doing that for some reason. Do you find that?
It is difficult. It's going back to that, the roles and understanding my role as a parent, their role as a child, and when do we cross that line? I mean, when does that line get crossed, and when is it inappropriate to be friends? You have to really be understanding of what line to draw and when. So it's understanding that role between parent and child, and respecting that, and not expecting the child to be parentified and be expected to do things that they wouldn't know how to do.
Glad you said that. There's a really good term, parentification. Can you explain that just a little more, because people out here may not know what that means?
It's going beyond what a child is capable of doing. So you have a few children in the home, and a parent is working full-time and may rely on the oldest child to pick up the pieces that they're not able to do effectively. And so they step into the role of a parent to either discipline or take care of the younger siblings, something that is beyond what they're maybe capable of doing emotionally, physically, mentally.
Yeah, they're not in a place where they can handle it.
Right.
But they're pushed into that position.
Right.
Gotcha. Okay. So, the parenting that you do, the National Nurturing Parenting Program, what kind of roles do you cover in that class, in that program?
The curriculum that I use, there's a variety depending on the target audience. And there is an assessment that we do, which is the AAPI, too, and that's something that Dr. Stephen Bavelet created, and that's what makes this program evidence-based. And so we give an assessment at the beginning and then at discharge. And the beginning, it does score the different constructs that I went over, the realistic expectations, discipline, appropriate roles, empathy, and independence. Oh. And so depending on how they score, more emphasis can be put into those different areas. But there's also like a substance abuse curriculum.
Oh.
There's one for teen parents. There's a variety. There's so much.
Oh, wow.
He has to offer.
Sounds like a pretty comprehensive curriculum there.
Yes.
And you talked earlier about parents sometimes have a resistance. Do you see resistance in all the groups, or is there a particular group where you see the most resistance?
Well, I mean, with the mandated clients, I think it becomes a little difficult to be told you have to do something. So once they come and they get adjusted, I mean, it does get better. However, initially having to be scored on an assessment and given feedback regarding that, it's difficult to take in. Depending on how they were brought up, there may be shame involved with that. With their parenting currently, there may be some guilt associated with why they're there, depending if they have addiction issues or if there's been some sort of physical abuse, emotional abuse. We do go over in depth the history of how they were parented, because that definitely ties in. But we're not there to judge. We're not there to punish them. We're there to support, encourage, give advice, give strategies so that they can become better parents and live in a happy environment and safe.
Good. That sounds really, really encouraging. I'm going to share something with you that another colleague of mine once stated. She was sitting in it was a group for batter intervention groups. And they got to talking about parenting and, punishment and physical violence. And they got to talking about how to parent. And one of the gentlemen who had been physically abused as a child basically said, well, if it's good enough for me, it's good enough for my kid. That kind of an attitude, How do you address that in your classes when you have, say, a mandated individual and they have this attitude of, well, it's good enough for me, it's good enough for my kid? How do you get past that?
I do validate that maybe their upbringing was tough. We go over what message they received from that upbringing. Again, I don't go to the point of judging. I ask them just to be open-minded regarding the education. Hear me out, let's go through this, and then we'll see where you're at. I can't change anybody's views if they don't want to change.
Right.
But I am there to let them know that I'm of support and just to be open-minded regarding the process. And I have to say, just about every client has been they've been open to a piece of this.
Oh, good. That's
absolutely.
That's
absolutely.
Yeah. Well, that's real encouraging. I'm glad to hear that. So what kind of feedback do you get from people in regards to either during the parenting class or after the parenting class? I'm already hearing resistance. I get that you're going to get that. But I'm also hearing that they seem to be open to it. Do you get positive feedback at the end? Like people say, wow, that was really great. I want to tell my friends to come get it?
Yes. So if they have visits with their children, if they are spending more time with their children and they're starting to implement these techniques, initially the children, they may be resistant too. So it's challenging and it can be discouraging, and they may question if it's even working. However, as they maintain that and they stay consistent and follow through, which is also what I teach, they will find that that system will start to shift a little bit. And that's a good feeling.
Yeah, I would imagine it is. Some of the folks, I would imagine, only because we tend to role model and pass on, have probably been traumatized. Do you offer therapy, or do you suggest that as an adjunct to the parenting?
Absolutely.
Okay.
Yes.
And are they receptive to that?
They may be, depending on their history with that, but it's taking them aside, especially if it's a group setting, and just giving them those resources.
Okay. Let's back up if we can for just a minute. I mentioned that you work for CALM, Child Abuse Listening and Mediation, and I had worked for them some years ago. I would like you to talk a little bit about that, because I know they have a presence here in Santa Maria. What do they do?
There's various programs at CALM, and we serve children and families depending on their need. My particular program, I work for Family Drug Treatment Court, and that's the program where individuals are assigned to parenting groups through their case plan.
Okay, I see. And do you ever have to appear in court?
I do.
Okay.
I give updates regarding their progress,
Okay.
depending on how far that case goes. I also speak to how they did overall.
I see. Oh, okay. So we talked earlier about how the parents, even though they might be resistant in the beginning, they seem to come to an acceptance of it and work with it by and large. How are the judges looking at the program? I'm just curious. What kind of response?
Well, it's a part of their case plan, and the judge is a part of the team that I work with. And so they're very open to this process. I believe he's seen huge changes in the clients that present before him. The clients are able to speak to their progress, so he's hearing it right from them. I do believe he sees the children as well, so he's also able to view that. Along with the other service providers, that input is given from them as well.
Okay. I'm going to ask kind of a tough question here, so bear with me, because this goes back upon my years of experience and things that I've heard over the years. You had mentioned the changing times and the changing perspective, and you talked about how the gentleman who's responsible for this program that you do, there's a no tolerance for any kind of corporal punishment. And as I told you, my father's response to me, he didn't know any better. I have heard, and I guess I'm asking you, even though you're not with Children's Welfare Services, there's certain criteria that's used to determine whether or not that's an okay thing to do, such as spanking is only with a hand. You don't use any kind of object like a stick or a paddle or anything like that. You only use your hand. There can be no bruises left. And I actually heard the California Supreme Court ruled that 7 is the limit for the number of swats. Yeah.
I haven't heard that one.
Yeah, this was a number of years ago. And so they're saying that, yes, if you're going to spank, it's only with the hand, and obviously, according to the California Supreme Court, no more than 7 times. But he suggests no corporal punishment. So I'm going to take it a step further. What kind of things can you use as a consequence for crossing those boundaries we talked about earlier?
Taking privileges away.
Okay.
Timeouts.
Okay.
Talking with your children and finding out why the behavior is occurring. Spending the time to get on their level and finding what the issue is.
Okay.
There's many other ways to address an issue rather than sending the message of physical violence.
Well, I totally agree with that, even though I was raised with a lot of physical violence.
Right. And I in my trainings to facilitators, I I do voice, why is it okay to hit a child, but it's not okay for an adult to hit another adult?
Oh, good point. I've never heard anybody say that before. That's a very good point.
And it gets them thinking, and it's the truth. It's also, I always go back to, what message are you trying to send? What message is that child receiving? If they're hitting their sibling, and you go up to the individual hitting their sibling, don't hit your sister while you're hitting them.
Yeah.
It doesn't make a whole lot of sense.
No, you're sending a double message there, aren't you? Yeah, right. It's one of the things that I talk about again in my class when I teach. I talk about that very thing in terms of, the kind of messages you're sending and double messages, and violence begets violence, and 30% of abused children end up becoming abusive parents.
Right.
And it's right there because, again, the role modeling. And you must see an awful lot of that.
Yes.
Yeah.
Yes.
So how long are these courses?
The course that I teach is 6 months.
Oh, wow.
There are courses that go a year long.
Wow.
Sometimes individuals have mandates from probation that they require 52 weeks of parenting.
Wow. So these are weekly sessions. How long are the sessions?
Yes, about an hour, hour and a half.
Hour and a half.
I usually give homework assignments along with the hour.
I'm sorry, I'm going to back way up again. You mentioned earlier that are the children there during the class, or?
No, but there are groups that involve the children as well. I don't do those groups, but there are. I do accompany individuals while they're visiting with their children, just to oversee and help with supporting, implementing the techniques that we go over.
Okay, sounds good.
Yeah.
One of the things that I had mentioned was role modeling, and I talked about how, 30% of abused children end up becoming abusive parents. One of the things that we don't talk about is the 70% that don't abuse. And the reason I bring it up is because I see a lot of overly permissive parenting where there aren't any boundaries being set. And I get to thinking sometimes, are these that 70% that they're afraid? Because I know that's what happened to me. I'll just real quickly tell you from a personal experience. When my first child came along, I was afraid to be the abusive parent. And so my mother comes up to visit one time, and Michael did something, and she said, well, my God, aren't you going to discipline him? And I freaked, But at that point, I was an undergraduate, and I was learning about developmental psychology and, how to work with kids and stuff like that. And so I developed a plan for working with him that was not abusive. But it occurs to me, the people who don't want to be abusive, who were abused, where do they learn how to be a parent?
Where do they learn how to be a parent?
Yeah. Because if you think about it, I mean, I had the benefit of being an undergraduate in psychology, but this is why I think your classes are so very important, because of the fact that if you're that 70% that don't want to be abusive, and so you're afraid to really parent the way your parents did, where do you learn to parent?
Well, we know nature versus nurture. It's your environment. According to Dr. Stephen Bavelek, 80% is your environment. 20% is nature, what we're born with. So who are they learning from?
That's my point.
Their peers, turning to a different family that's not their own. I think it's skewed boundaries as well. And when you're permissive, you're not setting those limits.
Right. Yeah, that's a real concern for me. And you said something else there, the environment. And I had one parent, and I just kind of freaked because she had been going online to a group to justify her, she wasn't abusive, but her overly aggressive behavior towards her child, because it was a group of parents who had very, let's just say, dynamic children. And so they were supporting one another to be aggressive. And I went, oh my God, tell me this isn't happening, you know?
And then you question why that had to take place anyway.
Yeah.
Why do you need that reassurance? Why do you need
Right. And
to be
but
told
it's
it's
really
okay?
disturbing that there are sites out there
Oh, right.
that promote really negative attitudes towards child rearing. You know.
Well, if you think about it, implementing these different strategies takes time and patience, and it can be quite discouraging. I'm a parent. I know that it takes a lot of time, and the follow through can be very time consuming.
Yeah, I tell my parents, since I don't work with children, I tell the couples I do see who are parents, I said, parenting is, to me, probably the toughest job in the world. But if you do those kind of techniques and rules, you follow those rules, the kind of parenting things that you're teaching, if you follow those, parenting actually becomes pretty simple.
Yeah.
It becomes easy. You know, because the structure's there,
Right.
the boundaries are there, the discipline is there.
Right.
It's all there. It's like
Right.
piece of cake.
Absolutely.
Yeah.
It takes time now, but in the long run, it's going to be so much easier and rewarding.
Yeah, I know. If I'm going to get personal here again, my one son, Eric, if you're out there listening, Eric, I apologize, but I'm going to bring you up. You know, because I did set boundaries and did have discipline and that sort of thing, when he hit adolescence, it was really interesting. He had a friend of his come up and visit, and being in adolescence, you know, he had to mouth off to me in front of the other kid to show him what a tough guy he was, you know. That other kid had no sooner left than Eric walked in, confronted me and said, "I'm sorry, Dad." And I just looked at him and said, "It's okay, Eric, just don't do that again." I didn't have to discipline him. I didn't have to say anything. I never said a word to him. He knew. He knew. So I had no trouble with kids when they went through adolescence. I had 4 kids. No problems.
Yeah.
So I'm all about boundaries and, you know, discipline and, you know, it works.
Right. Right. And it's
So-
about praising the children. You want to catch them doing good things.
Yes.
It's
Oh my
not
gosh.
just pointing out
Yeah.
the bad. We really want to highlight those moments so they know and they want to continue to doing well.
Yeah, I tell all my parents, consequences, that's positive too. It ain't negative. Consequences, we tend to think consequences is negative. No. Consequences, wow, you did a good job. You get an ice cream.
Yeah.
You know, it can be a positive thing.
Yes.
So I really do encourage folks to understand that consequences is not necessarily negative. So again, thank you for joining us. Hope you've learned some things and look forward to seeing you again. And just want to again extend my thank yous to Robin Cofield, who's just one of our outstanding therapists in the area.
Thank you very much for having me. I appreciate it.
Okay.